Hey friends, my name's Jessica and I'm a second-year doctoral student studying nursing practice. And in today's video, I want to talk to you guys about inpatient safety. I want to talk about basic safety precautions every nurse should be aware of. And then I also want to go over what the research shows with you guys. So when I talk about inpatient safety precautions, what I mean is when we have patients who might be having suicidal thoughts or homicidal thoughts, or maybe idolizing self-harm, we need to take certain safety precautions in the hospital to make sure that this does not occur, because we want to protect both our patients and ourselves, as well as the staff. So the reason I wanted to have this conversation is because in my doctoral program, we have a lot of discussions throughout the semester around certain things, and I was just very, very surprised to hear about stories from medical units about these types of patients and some of the horrific things that have happened. And in psychiatry, we mostly have this down pat. We're going to go over the different things that patients are and aren't allowed. However, I've found in my doctoral program, talking to other students specifically who don't work in psychiatric units, that work in other units, that they do not always have protocols or procedures to protect staff. I also found that quite a few nurses were not aware of what the safety precautions should be with these types of patients. So I think that this is a discussion we as nurses need to have, because it is very important for us to understand what should be done for patients that are at risk for harming themselves or others. And there's various reasons this could be. This could be due to an intoxication, a mental health disorder, recurring traumas, things like that. But we need to be aware of these safety precautions, because unfortunately, really bad assaults, and this is what we talked about in my class, and I'm not going to get into too much detail, but there was one student that specifically talked about staff getting really, really assaulted terribly for something that could have been easily avoided. And we're going to go through what these precautions should be, because if staff had been aware of what was appropriate and not appropriate for this patient, this would not have occurred. For example, with this specific situation, these patients should have plastic utensils when food comes up from the kitchen. However, on medical units, oftentimes they might make a mistake in the kitchen bringing food up to medical units, because everyone else in the medical unit gets metal forks and knives and things like that. So sometimes this can easily go unseen or unaddressed if they have a patient who specifically needs plastic utensils. So this is something that nursing staff, CNA, one-to-ones should all be understanding of this, so that these terrible things don't happen. So let's go through it. Two parts. So first, we're going to talk about the basic safety precautions that every nurse should know. So it's funny, because when I go to medical units and I look around, it gives me anxiety. Like, I start to panic because I can look around right away and know safety issue, safety issue, safety issue. So if you have a patient who is a danger to themselves or to others, number one, you need to watch out for things such as utensils. They should be getting plastic utensils with their meals, not metal utensils. Another thing that you should watch out for is pens or pencils. And we're going to go through the research at the end of this. And this is something that some inpatient units do and some don't. But I think they should do, especially after looking at the research. My personal opinion is that we need to allow patients autonomy and freedom, and they should be allowed certain things. You cannot take writing utensils from them. You can implement safer alternatives. We'll go through that at the end. The other thing to look for is something called ligature risk. And a ligature risk is something that somebody could attach something to, or I don't want to get super detailed on this, but it's like a door handle or a bed rail, something where someone could attach themselves to if they wanted to cause themselves harm. So bed rails, cords, cables, any strings, shoelaces, bed bed sheets have happened. There's all of these different things that can be used for that. And this is actually the most dangerous one. Again, we're going to go through the research, but this is why typically on a medical unit, these patients are on a 1-to-1 because there's just so many. I mean, I walk into a medical unit and I get anxiety because I can just see them all out of the corner of my eye. It's difficult. So that is typically why patients are on 1-to-1 because of that. The next thing to watch for is, I'm not sure in medical units how this works, but in psychiatry, usually patients can use razors with supervision by staff. But yes, any type of razor or sharp object, you want to be careful of any metal sharps. Sometimes, like if someone's wearing a chain with a pendant, you got to look, that pendant can be used for harm. There's anything like that, any big metal object can really be used to harm. Another thing is windows, and we're going to go through the research at the end, but it depends the unit that you're on, but do the windows open? Are there balconies? Are there ledges? All of these things are important to look for. Okay, so the other issue is how well is the staff trained? So a patient in a medical unit may be with a sitter, but is that sitter appropriate? For example, what I mean is if you have a patient who is having thoughts of harm to themselves or others, and they are on a 1-to-1 with a person who's 70 years old and is small and frail and really is a sitter in the sense that they should be sitting with someone who is confused, that just needs a little bit of redirection, not somebody who is a violent threat. That is another issue when certain things do happen. And like I said in my doctoral program, when I was talking to some other students, their issues with things that happened was the nurse didn't know that the patient shouldn't have metal utensils. The CNA didn't know the patient shouldn't have metal utensils. The sitter was watching the patient eat with the metal utensils and did not know that they shouldn't have them. And then the patient was able to then hide a metal utensil. And it's just this snowball. So how well is staff trained? So this is why I also wanted to make this video, because we don't always receive these discussions and these trainings in nursing school or when we get nursing jobs, and it's our lives on the line and it's our coworkers' lives. So it's very important that everyone is trained adequately, because somebody can get really, really hurt. All right, so let's go on to what the research shows. And this is one of my favorite areas of research. Like, I just get so excited. I did an entire project on this for my healthcare quality class, so that's why I also wanted to talk to you guys. Okay, so let's go over the research. And I just want to preface this by saying that I have to be careful what I say on YouTube. I don't know what is okay and not okay to talk about. There's a little thing that pops up when you upload a video that says, are any controversial topics? So there are certain words that I don't want to use just because I don't want to do anything that I'm not supposed to do. So if it sounds like I'm saying things and I'm kind of walking around a main idea, I'm talking about that main idea. Okay, so when we look at the research, there were a couple studies done by the Veterans Association, which was really, really great. And the reason why these articles were so great is because the Veterans Association has over 100 different psychiatric units that they can look at for detail. So they're getting a lot of information. And this is important when we're doing research because we need large amounts of information to be able to calculate adequate statistics. So what they did is they were having a lot of inpatient harm that led to death caused by patients in their psychiatric unit. So they wanted to go in and see what could they do different. So they looked at all the things, what was causing harm to the point of death to these patients. And what they found was a lot of times it was what we talked about earlier, the ligature risks, which again is something that can hold body weight and that you could attach something to. Another issue was open windows or balconies, people jumping essentially. Another huge issue. Okay, so for the Veterans Association, they had 152 hospitals that they looked at, and what they found was for completed harm that led to patient death inflicted by patient, again, I have to be careful what words I use, 43.6 were from a ligature issue, 22.6% were from cutting, and 15.6% was from strangulation. This meant that 81.5% of all of the completed self-harm events that led to death in these 152 VA hospitals were done and completed by objects that were found in the psychiatric unit. Now again, we're talking psychiatric units. There's a lot less objects in psychiatrics than medical units, so that is why it's so important that we're educated on the things to watch for. So materials used as weapons was the second largest hazard, and this includes moldings, cords, utensils, chairs, I didn't even think of that one, artwork, dressers, dresser drawer, and any small object that can be used to harm. And also anything that is a string or a belt. So the reason we're talking about all of these things is because it's important for you as nurses to be aware of what safety hazards are. Now that research that I just talked about, that was specifically talking about inpatient psychiatric units, which are already created to be safe. So with that study, what ended up happening is they created this checklist for environmental safety, and they went through all the units and they implemented this checklist, which if you guys are interested, let me know and I can link you down below. But anyways, what this checklist did is it reduces those ligature points. We talked about chairs were a safety issue. They started using weighted chairs that can't be thrown or used as weapons. Go through with this checklist, and what they ended up finding is they reduced the incidence of patients dying due to self-inflicted injuries from 2.64 per 100,000 to 0.84 per 100,000, which probably doesn't sound super huge, but when you're talking a patient's life and you're reducing it by over 2/3, that is very good. So typically in psychiatric units now, they use something similar where they have all these safety precautions, different things, even bed frames on beds. They're all made to be safe. However, when you're working in a medical unit, you don't have this opportunity. So at times, I actually think, a lot of people are like, oh, inpatient psychiatric units are so unsafe. And yes, there are more assaults in inpatient psychiatric units than any other units. But in a sense, you get that one violent patient and you put them in a medical unit, they can really hurt people. So this is why it's important to know what is okay and not okay for patients that are having these thoughts and these feelings. So I hope you guys enjoyed this video. I hope that you found it informative. I think this is an important conversation that as nurses we need to have and for you to be aware of, because after hearing the stories in my nursing class of nurses on these medical units and people getting really hurt, I just think that it's important that we have this discussion so that we can avoid these situations. Okay, so if you like this video, make sure to give it a thumbs up and subscribe below, and come back to have some more meaningful conversations. Talk to you guys soon. Bye.